Okay, HSA. Let's explain this in a nutshell. Simple and easy. So, the health savings account is a vehicle where you can take some of your hard earned money and put it away in what's called the health savings account. It's an actual bank account. Your employer will decide which bank they're going to use or or allow you to select whatever bank you want to use. Most of the time, when your employer chooses it, they're paying the administrative fee, which is pretty nice. If you choose it, obviously you're going to pay. It's usually a few dollars, nothing big. But let's give you some of the rules behind the health savings account. Now, the first thing is to have a health savings account, you have to be on a high deductible health plan. Most employees want to ask, can I have the PPO or the HMO with the HSA? No, you can't. You have to be on a high deductible health plan. It has to meet a minimum deductible and a minimum out of pocket to be able to attach this beautiful thing called that health savings account. It usually comes with a debit card, just so you know. And this card is what you're going to use to pay for your deductible, your co-insurance, and maybe other things that you have to pay for out of health, medical, dental, vision expenses that you may have coming out of your pocket. So great card. Especially if your employer gave you some first dollars or seed money to put into your account, you get to use them as you wish. I'm just hoping that you're saving enough for that worst case scenario, that deductible and out of pocket max. So let's get back. HSA, you have to qualify for it, meaning that you have to be on a high deductible health plan, and you can't be on anybody else's health plan that is not a high deductible health plan. So if my spouse said, Sonia, I'm going to put you on my Kaiser plan, then I don't qualify. It has to be another high deductible health plan for me to be able to have dual coverage. Okay. Third, remember that you can have, it has to be your tax qualified dependents. So that means that my children are under age 26, still on my health plan, but they do their own tax return. I can't use my HSA dollars to pay for their expenses. They'll have to open up their own HSA account so they could put away some of their hard-earned money. Hey, start making them pay some of those medical bills, or I can gift them some money into their HSA account and they can put money away. So remember that. That's another rule, that you have to be a tax qualified dependent to use the monies in the HSA. Lastly, TRICARE, Medicare, if you're already on those, you can't have this. One thing I would tell you folks out there with Medicare, if you're getting close to that retirement age, call the Social Security office, ask them if you can postpone it, especially if you're going to continue working and you want to contribute into your health savings account, your health savings account, you want to continue contributing. Sometimes you may be able to delay the enrollment into Part A because that's the one that's automatically started when you turn age 65. So just give them a call. I don't know the rules behind Medicare, but I'm sure they'll be able to help you in guiding you how you would go about doing that. But again, can't have Medicare if you're going to be on an HSA account. Next, this account allows you the ability to take some of your hard-earned money out of your paycheck if your employer offers that, to put away into this health savings account. Most of the time it's pre-tax, meaning in California, at least, we get the federal tax free. We still pay state taxes, but in most states, you don't pay state and you don't pay federal. So it's truly an advantage of not having to pay taxes on some of your hard-earned money for your future healthcare cost. Secondly, as the money sits in that account, most HSA banks allow you the ability to do investment options, whether it be direct funds or mutual funds. You get to decide how you want to invest those dollars. And usually they have a threshold. Most of them are about $1,000 or $2,000, but now you're able to make investment choices. And one of the nicest things about the HSA account is that you can always change your contribution into the account. There's not really, some employers might have some rules where they don't want to change frequently because of the administrative part, but most employers allow you to change your contribution at any time if something were to change in your situation. But the monies that you're contributing have a maximum that you can contribute per year. So you want to look those up for the year 2025 and 2026. It includes the amount, if your employer gave you some money, it's the total amount, including your employer's amount. That's the most that you can put away. There's an individual amount, there's a family amount, and then there's an extra $1,000 for those of us that are 55 and above. Another thing that I want to remind you of, the monies in the account, you never lose them. They're always yours. Even when you get to Medicare and you become eligible, you can even use it for things like paying for long-term care, COBRA premiums in between jobs, and also Medicare premiums if you wanted to use those dollars for that. After the age of 65, You can use the money for income if you wanted to as well. You'll just pay ordinary income tax since you've never paid taxes on the money. But like I said, monies roll year over year, over and over. So it doesn't mean you never lose your money. If you separate employment, you take the money's yours. If you pass away, you get to leave a beneficiary for that account, and they get to inherit a HSA account. But just a great vehicle that if you really want to put away some of your hard-earned money for your healthcare future, this is the way to do it. I personally, one tip that I would give is if you're thinking of doing a procedure that might not be covered by your plan, this might be a great way to do it. Something like IVF, right? That costs like $10,000. You can put away enough money year after year, right? To finally accumulate what you need to be able to do that and use these pre-tax dollars to pay for it. You're the manager of the account. You keep the receipts. You make sure you know. So even if you don't have a lot of money at the beginning, and let's say you pay for a high-ticket item, as long as the account was open, any service after that, you're able to reimburse yourself once you have the money in the account. Or if you have the money in the account, you can always reimburse yourself if you paid for something with a credit card. So hope this helps. I'll give some more great tips on how to use your HSA to its maximum. So many things that can happen in our health that sometimes we don't quite understand, but there's something that can help support your immune system and you might not know about it. That's where I specialize in that. Click the link below and you'll be able to get more information on this specific product that I use to help support my overall health.